Thank you so Thank you so much for having me, Amy. It's such a pleasure to be here and talk to everybody today about balancing our metabolism and optimizing our metabolism and our hormones. So what I'm going to do is I'm going to go ahead and share my screen. And this way I will be sharing my presentation as well. Let's see here. It might be that my Zoom on this computer does not want me to share screen, which I apologize for if that's the case. We can either just chat or maybe I can very quickly figure out how to do this. I apologize.
Bojana, if you want to email it to me, I can share it from my side as well.
Okay, perfect. Let me go ahead and do that.
And then after what, close to 18 months of this, I don't think anyone has figured out how to master Zoom.
You know what? I think it's actually too, I think the talk is actually too big to email. It exceeds the limit. Yes. Okay, let me see if I can just quickly give Zoom permissions to share this. And then if not, I'll just start talking and the visuals are really mainly just some of the points that I mentioned. So it probably doesn't make a whole lot of difference for people. I just know that sometimes it's nice for people to have like point by point when they're listening to a talk. So let's see here. All right, let's see if we can have. You know what? It doesn't seem that it actually is allowing me to find Zoom on here. So I'll just talk to you guys, and this way you'll just be able to see my face on the screen, and we could just have this informal conversation. So the topic that I'm going to be talking about is optimizing our metabolism and balancing our hormones. And I am going to focus more on PCOS, but I will really speak broadly with more of an emphasis on PCOS specifically, which stands for polycystic ovarian syndrome. We'll talk about what that is and how that's implicated in our metabolism and hormonal imbalances as well. Just to give a little bit of a disclaimer, of course, this is not medical advice. I will be mentioning some tests and I'll be mentioning some supplements, but I certainly recommend talking to your doctor before either undergoing any lifestyle changes, any nutritional changes, supplements, medications, of course, or getting any testing done. So why do we care about metabolism and why is this important? Well, we know that over 2 in 3 US adults have a body mass index that's over 25. We know that this leads to certain chronic disease risks, such as diabetes, such as heart disease, high blood pressure, high cholesterol, that we know that all of these are connected. And we know that our metabolism is also controlled by some factors that we cannot control and in some factors that we may be able to control. So while we'll talk about all of them, I'll obviously focus on the things that we actually can control. But I think it is really important to acknowledge that there are certain aspects of our physiology and of our metabolism that we just simply cannot control, because I find that sometimes people may get frustrated with, well, I'm working so hard to achieve this such and such weight or to achieve such and such balance. And so it's really important to look at ourselves in this personalized context as well. So what determines our metabolism? Well, one thing that's obvious is age, right? And so any, especially female patient that I talk to that's in her late 30s, 40s and above will certainly notice that after a certain age, there is more difficulty in maintaining a certain weight or in losing weight. And so this is in part a reflection of the changes in our metabolism. And what is metabolism? So the metabolism is the ability of our body to turn the food that we eat into energy. And so usually we refer to it, of course, in this context of weight loss or ability to keep weight off. But it really just comes down to our body's ability to utilize energy from the food we eat. And there are different components that make up our metabolic rate. And again, without getting too into detail, I'll just mention these just so that you're maybe familiar with some of the terms. There's the basal metabolic rate, which I'm sure everybody has heard about, which is essentially the energy that our body uses at rest, right? And so this is something that does go down with age. Then there's the thermic effect of food. This is the energy that our body uses to actually break down the food for both use as energy and for storage. Then there's the thermic effect of exercise. This is the amount of energy that we actually burn through exercising. Then there's something called NEAT, which stands for non-exercise activity thermogenesis, which is energy used while we're not sleeping, eating, or exercising. And then there's our overnight metabolic rate, the metabolic rate while we're asleep. And interestingly, this goes up in age, and it's one of the contributors with age-related sleep problems. And oftentimes, I'll hear patients say that with age, their sleep quality is worse. Well, this is one of the problems, one of the contributors to that. So, what are some of the factors that we can control with respect to our metabolism? And well, we can certainly control our habits, right? We can control what we eat, when we eat, and how much we eat. We can control how much we exercise, provided that we're able to exercise. We can control how much we sleep. And this is something that I always talk to patients about, because I really think that it's the foundation of health and the foundation of healthy habits. And I generally recommend that people aim for somewhere between 7 to 9 hours. Some people may need more on the higher end of the range, some people more on the lower end. Some require at least 8 hours of sleep, 7 is not enough. And then certainly things like red-eye flights and shift work can compromise that. So it's also important to be mindful of that as part of your lifestyle. Hydration, actually. So hydration can help us burn energy, and it can also support weight loss. So all of the recommendations about make sure you drink enough water, at least 2 liters of water a day, part of that, the basis for that is to support our metabolism as well. And then what about conditions and circumstances that have a negative effect on our metabolism? Well, rapid weight loss, for one. So this negatively affects our metabolism. So if you imagine that all of a sudden somebody starts severely calorically restricting, what happens is initially they will get that weight loss benefit that often occurs with a lot of the commercial diets and whatnot. However, what happens is, because our body has a certain set point of where we should be weight-wise, and because our thyroid function, which contributes to our metabolism, also has a certain set of normal values for us, our personal normal values, what happens is if there's a sudden drop in our weight, then our body actually works to counteract that, and it works to compensate that. Because if we imagine our ancestors from whom we evolved, when they were malnourished, when they didn't have access to food, a survival strategy was actually to hold on to the calories that they were absorbing. So if somebody goes from an 1,800 calorie diet to a 1,200 calorie diet per day, and they see this sudden caloric deficit and our body senses that, then our thyroid is going to adapt to that. Our metabolism is going to adapt to that. And actually we'll find that, okay, even if we continue consuming these lower calories, our body is actually just going to be less efficient at utilizing them and more efficient at actually storing fat. So this is a counter active measure actually for metabolism. And then certain conditions, certainly type 2 diabetes and insulin resistance, they're also correlated with an increased basal metabolic rate, and then underactive thyroid, and stress can certainly, and the hormone cortisol can certainly slow down our metabolism. And then interestingly, and you may have heard this before, lower room temperature and exposure to cold can actually help us burn calories by helping us build brown fat. So, so as I mentioned, age we cannot control, right? Our genes we cannot control. And part of what determines our metabolism is, again, how we utilize, how our genetic predisposition has us utilizing our calories. And so there is this effect of genes on our ability to control our weight. And then certain medications. When people are on certain medications, such as certain psychiatric medications, for instance, for mood symptoms, for depression, or beta blockers, or certain antipsychotic medications, they can certainly affect our metabolism and our ability to control our weight. So now that we've kind of broken things down into certain things that we just cannot do anything about and certain things that we can control, what I'd like to do is for the next part of our talk, I'd like to focus on the sort of the when, the what, and the how much of eating, because nutrition really is a huge determinant here with respect to our metabolism and with respect to our habits and with respect to our ability to control our and balance our hormones. And then I'd like to focus a little bit on PCOS and how that is related to some of these nutritional interventions that I'm going to mention. So a lot of people ask, whether they should have breakfast every day. Interestingly, we know that studies show us that there is a correlation between people with a lower body mass index and individuals that eat breakfast. So from that, this assumption was made that, okay, if I eat breakfast, I'm going to have a lower body mass index. On the flip side, there has been a lot of publicity around intermittent fasting and various fasting schedules, which oftentimes actually promote skipping breakfast. So there's this conflict in the literature and in the recommendations, which often leaves people confused. Should I eat breakfast or should I not? So let's first address breakfast itself. So yes, there is this correlation. It is possible that this is the case. What I generally tell people is that everybody's different. Some people really don't mind skipping breakfast. And in fact, they feel that it fits better with their lifestyle. Let's say if in the morning they're waking up, they're dropping off their kids at their school, they're running to work, they have so much going on, and they're fine not having breakfast, then there's no reason to force themselves to eat breakfast if their body is naturally just telling them, and if their lifestyle is naturally just suggesting that, no, this is not something that you really require. On the flip side, if another person wakes up and they feel that, an hour into their day, they feel that they're starving and they just absolutely cannot go without breakfast, and it's absolutely essential for their workout and for their day and for their cognitive function, then of course, listen to your body, do what makes the most sense for you. That being said, even if you eat breakfast, you can still practice intermittent fasting and time-restricted feeding. And this is something that actually has a great body of evidence to support our metabolism and to support our insulin sensitivity, which is one of the problems that we often encounter when we have PCOS and when we have metabolic syndrome, is that insulin resistance. So there's a question of, well, how then do we enhance that our body sensitivity to insulin and counteract some of those metabolic effects of insulin? And so one of the ways in which we can do that is by intermittent fasting. And I'm happy to actually take any questions on that if you'd like me to elaborate, or I can do that at the end of the talk, because that's a whole other talk in itself, but I can certainly talk a little bit more about the schedules if somebody is interested in the specific schedules that they may want to consider. Now, another kind of, thing that we've been taught for a very long time is that, keep eating small, frequent meals throughout the day to keep your metabolism going. That is not the case. What we actually want is if we keep eating throughout the day, right? And if we don't have any breaks, that actually keeps our insulin levels high, because all foods, carbs, proteins, and fats, they all stimulate insulin. Of course, carbs the most, then protein, and fats the least. But nevertheless, if we're consuming food, we are stimulating insulin. And if we continuously stimulate insulin secretion, and we're continuously exposing our cells of our body to insulin, which helps us get glucose into the cells or blood sugar into the cells, what happens is over time, we can build up this insulin resistance. And then our body requires the pancreas to produce even more insulin so that it can be responsive to it to get the blood sugars into the cells. So we actually don't want this, right? So then we want to have breaks during the day and well-defined meals where a meal occurs, there's the signal for insulin, and then the insulin level goes down afterwards. And then another meal occurs, and again, there's a signal for insulin, and then the insulin level goes down afterwards. And then ideally, there's some time of intermittent fasting between that last meal of the day and the first meal of the next day. And we can talk about, again, those specific times. So we want to, number one, we want to eat to satiety. We don't want to starve ourselves. We don't want to necessarily have a small meal if we are hungry, but at the same time, we want to have well-defined meals rather than grazing throughout the day. Now, what about the actual, some of the factors that increase the metabolic rate after the meal? Well, intake of high carbs and high protein meals is something that increases the metabolic rate. Of course, it's going to stimulate insulin as well, but when we're having a meal, this is natural. It's also interesting that intake of medium chain triglycerols rather than the long chain ones can also increase our metabolic rate. And this is why people, take the MCT, and there's mixed evidence on this really. So, but it is something that has been shown to increase metabolic rate. Plant-based diets can also help increase metabolic rate. Now, a lot of people ask me about MCTs and whether they should be, consuming them, your MCT oil and coffee, or whether, you should be consuming it to increase your metabolic rate. Again, there are studies that show that MCTs do appear to increase the amount of energy that our body uses, and they appear to show this trend toward a reduction in body fat in women who are overweight. However, there's just simply not enough evidence to necessarily make that recommendation. And in practice, I have found mixed results. So I don't specifically recommend MCT oil supplementation. And again, clinically, I just haven't observed a significant enough of an effect. So we talked a little bit about our nutrition, a little bit about what we eat, a little bit about the plant-based diet, the whole food plant-based diet, how much we eat and when we're eating. Exercise as well, I mentioned this, and some of those factors with exercise that are concerned with metabolism is obviously the frequency of exercise, duration, intensity, and the type of exercise. And then our set point as well, right? Something that we're born with, something that that we're predisposed to. And then also how much lean body mass we have, to a lesser degree, can also affect our metabolism. Okay. So now with respect to the kind of breakdown in terms of our nutrition. So there are many different types of diets, right? From low carb to strictly keto diets, to paleo diets, to plant-based diets. Rather than going through each diet and the level of evidence for each one, I'll just share with you a little bit about what we should all actually be eating. And of course, for different individuals, this is going to slightly vary depending on whether you may have certain sensitivities to certain food groups, whether you may notice some other types of gastrointestinal, let's say, symptoms to certain food groups and whatnot. And so, of course, if that's the case, of course, address this with your healthcare practitioner. But in general, what I support and what there's really the most robust evidence for is that we all should be eating a plant-rich diet. So generally, I recommend to people to eat at least 75% of plants at each meal. And now when we say plant-rich diet or plant-based diet, I don't mean processed plant-based foods, right? Because Oreos are vegan, right? And so we're not talking about that. We're talking about actual vegetables. We're talking about fruit. We're talking about legumes. We're talking about nuts and seeds. We're talking about healthy oils. That's really where we're focusing on. And then, of course, for individuals who are consuming animal products, who are consuming meat, of course, make sure that it's grass-fed, make sure that it's organic and well-sourced, and that it really generally doesn't exceed more than, the 25% of what you're actually eating. Now, for individuals that are looking at, and again, for individuals struggling with PCOS, or for individuals that are looking to support their weight, generally, when we talk about vegetables, we exclude the starchy vegetables because they generally are higher in carbs. They generally can be more calorically dense. And then also, when we talk about fruit, we certainly want to limit some of the higher glycemic index fruit, especially in individuals who might have insulin resistance, who may have pre-diabetes or diabetes, and again, individuals that are looking to lower their weight. So generally lower glycemic index fruit. So think berries, think green apples, pears, and then non-starchy vegetables, and then certainly supporting that with healthy fats, whether it's avocados, nuts and seeds, as well as legumes as one of your sources of protein, certainly. Any questions about that? We certainly could go into more details, but I want to make sure that I get to the PCOS piece as well, and that we kind of have time to tie it all nicely together. No questions so far? Okay.
I have one question for you, Dr.
Yes.
Kick it off. So when you were talking about the intermittent fasting, you were talking about like how you want to get that insulin level down between, but then how do cravings fit into that? Because I feel like you start craving sugar, or I mean, I'm speaking for myself. Like I start craving like carbs at random points in the day, and it's obviously between meals. But I feel like that's just my body wanting me to bring my insulin back up. Okay, so how does that, like, why do those happen, and how do we kind of handle that and navigate that in a healthy way?
Yeah, that's a really good question. So there definitely could be several reasons for that. So one of the things that could be happening is, depending upon what your last meal was prior to that, and what your insulin response was to that, and then how well your basically what can happen is, let's say, I'm just gonna like talk about an extreme case, but let's say I eat a piece of chocolate, right, that's high in sugar but low in fiber. What's going to happen is my insulin response is going to be very elevated in response to that elevated blood sugar, because that was very quickly absorbed through my GI tract because there's no fiber and there's a lot of sugar there, right? So in response to that, insulin levels go up, and then that insulin drives that blood sugar into the cells. What can happen is there can be, like, sometimes people will describe this, we call it postprandial hypoglycemia, meaning after they eat, basically what'll happen is their blood sugar will go down very low, and then that's when they'll get hungry for another meal. And I certainly notice this when I have cravings for sweets, because we all do. If I have something that's very sweet, very high carb, low fiber, I will definitely, maybe an hour or two after that meal, I'm going to have a craving for more. Now, sometimes it can feel like actual hunger, and sometimes I can tell it's a craving, like I just want that specific thing. I'm not really hungry, but I just want that specific thing. And in part, that can be because of this imbalance, because the previous meal caused this blood sugar to just go up high, which stimulated the insulin, which then stimulated the blood sugar to go down very quickly, which is then telling us, okay, now it's time for something else because your blood sugar just dipped. So that could be one thing. The other thing that could be happening, sometimes it takes time for people to get used to these waves of hunger that can occur during a fast, and then the waves actually can go away. So what I often find is, if I'm doing a 24-hour fast, I find that I do have certain waves of hunger, but then generally, if I either focus on another task, or drink a lot of water, or teas, that generally tends to go away. Now, of course, if you're feeling that you're starving and it's just not working for you, then I would suggest a shorter fasting period, and then just slowly lengthening that over time. And then, like, picking those fasting days wisely, so that there are not too many things that can, sort of trigger you, so to speak, or where you're kind of busy enough where your attention is on something else, but it's not so overwhelming that you're like, just give me, some calories, I need to function, because that can certainly happen. The other thing that I've noticed, certainly in myself and in my patients, is that it can sometimes be affected by the cycle, right? So if there's certain times in your cycle, like leading up to and during your period, that's usually, in my experience, I found that's not usually a time where I'm going to be very successful at a long fast. So I just generally do shorter fasting, and it's really more of that time restricted feeding, where I do the 14-10 schedule, where I eat during 10 hours of the day, and then I fast for 14 at night. And if you're sleeping 8 or 9 hours a night, ideally, that's really only 5 or 6 hours that you're not eating while you're awake, and the rest of the hours you are. So I would say, like, playing around with the time of the cycle, playing around with the duration of the fast, and then playing around with what your meals were before that, and then just strategically picking those days.
That's interesting. Thank you.
Yeah.
Did get a few questions in the chat. I'm gonna welcome you guys to ask the questions live, but if you prefer for me to ask them, I'm happy to do that too.
Oh, so can I actually ask the question?
Yes.
Yeah. Okay. Oh, all right. Well, I'll just repeat it. So basically, I did a glucose tolerance test several months ago, and my insulin rose significantly after consuming the sugary drink they gave me for the test. So when she drew out my blood the second time, on the test results, it appeared to be quite large. I'm not diabetic yet, my doctor says, but, she says that I really should monitor this. And because I do have insulin resistant PCOS, she said that, that to take metformin, but I'm a bit against metformin because I want to try more natural approaches, because I know that metformin decreases, vitamin B12 levels and maybe other stuff as well. So I really don't want to do that to myself either. So I was just wondering what your opinion is.
This is a great question. Yeah, and thank you for sharing that. So, while I can't give you direct medical advice, I'll tell you what are some of the options in general that you may want to consider. So many women with PCOS are in your exact situation, where they're dealing with insulin resistance, and they may have tried a lot of things, or they're being offered medications, and they want to know, okay, what can I do proactively that can help me? And so one of the things I would highly recommend reading, if you're not familiar with yet, and I'm going to type him in the box here, Dr. Jason Fung. He is a nephrologist, actually, from Toronto, and he writes quite a bit about fasting and about insulin resistance and how we can sensitize our body to insulin with using fasting strategies. And so one of the things that he writes about is that, one of the reasons for some of these more prolonged fasts, like 24 hours or 36 hours, is that actually we have found that the insulin sensitivity and the insulin values start to drop when we allow our body that period of rest of 24 to 36 hours of no food. And so he is someone who's very well researched in this area, and who writes a lot about this. So that would be a great reference for you if you have not read his content yet, or his books yet. And that can give you a suggestion as to where you may want to start potentially with respect to fasting. But that is something that can sensitize your body to insulin. Everybody responds differently, but it is something that I see in practice, and that's certainly possible. And then the other piece is if you haven't yet worked with a nutritionist, with a dietitian who specializes in PCOS, this is something that can be really helpful, because determining, what specific diet best suits you. And even though, the American Diabetes Association, and I'm not sure the regulatory body in Australia, but I'm sure Australia has one as well, they'll have certain guidelines noted, and they'll say, plant-based diet and low carb and this and that. But the truth is, when you actually look at people who measure their blood glucose levels, and now with the emergence of continuous glucose monitoring, we see that people are affected by different carbs in a different way. So you may find that, bread and rice are just a no-no for good, because this just really triggers my insulin. But I can have maybe, vegetable or fruit, or, eggs, or whatever else. So I think that working with a qualified registered dietitian, physician, to really try and figure out the plan, the nutritional plan for you, but then also this fasting schedule that you can maintain, but that also is going to over time help support your insulin levels. I hear your concern about metformin and about the possibility of B12 deficiency, and that certainly can occur. That being said, metformin is also effective at improving insulin sensitivity. And so it is something that is used widely, and that I'm not necessarily against, actually. So it is something to consider. It certainly is something to consider. The other piece as well, there's less evidence for this, but I always mention it too, certainly when I talk to my patients, making sure that your vitamin D levels are adequate, making sure that that nutritionally you're well supported. Vitamin D and magnesium are implicated in blood glucose regulation. So those are some of the things that that you may want to consider talking to your provider about. And then there is some evidence that chromium picolinate can help with blood glucose levels, as well as actually cinnamon, just adding cinnamon to your food, that can also help with blood glucose levels. And then just looking for more high fiber, low glycemic index food, healthy fats, healthy proteins, and so on. So I hope that was helpful.
We had another question. I don't know if you want to ask it live or if I should ask. All right, I can ask it. I follow IF. Why do I feel hungry during my eating window? I guess, Dr. Bojana, could you just define what IF is and then answer the question? Sure.
So I assume you mean intermittent fasting. And so do you mean why do I feel hungry during my eating window? I don't know that I understand that. Why do I feel hungry during my eating window? If you follow intermittent fasting, maybe you can define the question a little bit better, or what your schedule is, or are you surprised that you're feeling hungry during your eating window after having fasted, or would you expect not to feel so hungry? I'm sorry, I don't know that I fully understand.
Yes, so I follow intermittent fasting, and during my eating window, I feel hungry and craving for food all the time. It's like I already have a very big lunch at noon, and then at around 2 or 3 o'clock, I feel hungry again, and then I start to have dinner at around 5 o'clock, and yeah, so that is what I mean, like during my eating window from noon to 5 to 6 o'clock, I feel hungry all the time.
Got it. So you're just excessively hungry. Got it. Okay. See what you're saying.
Yeah.
Okay. So I would look into what you're eating for your meals when you are sitting down to eat. And if you're eating to satiety, meaning are you eating to fullness, and are you feeling fulfilled by that, let's say that lunch that you have at noon, or do you feel that you feel full and then just 2 hours, like it just sort of comes on again?
Yes, so for example, at my lunchtime, I will have I think I will have all kind of milk that I like. It's like vegetable and some rice, because I'm Asian and we usually eat rice. Vegetable, rice, and chicken or beef. So that's what I have. And then I have some fruit for dessert. Yeah, so I don't. Yeah, I think I eat to the fullness. During lunch.
Yeah, you know what I sometimes find, and I don't know, how much rice you have in proportion to your veggies and your animal protein. But what I sometimes find is if that carb portion of the meal is pretty significant, that's actually going to cause that, again, that insulin response, and then blood sugar goes in, and then the blood sugar dips. And then perhaps that's what you're feeling those 2 hours after, is that this insulin response was just caused by the balance of the meal. So maybe one of the things that I would try to do initially would perhaps be reducing the amount of rice that you're eating, increasing the veggies and the, let's say, chicken that you're eating, and maybe even introducing, maybe as a dessert, I would experiment with having some nuts and seeds. So again, having a little bit of higher fatty foods, which are going to keep you full longer, and see how that works. Because I wonder if maybe if maybe the amount of rice that you're consuming plus that fruit at the end, if that's a large enough glycemic load for you, then maybe that's what's causing that loop. So I would introduce more healthy fats and maybe scale back on this and see how you feel.
Yes, I would try it.
Mhm.
Thank you.
You're welcome. And then let us know, please.
Yes, I will in the next lecture.
Okay.
Dr. Bojana, why don't we jump into your next topic, just in the interest of time?
Perfect. Sounds good. Yes. So one of the other things that that just to kind of wrap things up with respect to nutrition, of course, part of this is also what do we drink, right? So generally, I recommend to people to aim for at least 2 to 3 liters of water per day. Of course, this varies depending on how much you're exercising, how much you're sweating, and so on, and if you're consuming other liquids. I also recommend, considering warm water with lemon or maybe warm water with ginger. Again, making sure that you're getting your liquids, especially during that fasting period. That can be really, really helpful. And then herbal teas. Coffee, again, coffee intake it obviously depends on the individual. I generally just recommend avoiding caffeine after noon because some people are slower metabolizers and it can keep them up, but I'm not necessarily strictly against coffee. Although there is a correlation between coffee and estrogen that some, women may have to be mindful of. And then avoiding alcohol or just using it sparingly, of course, because that also plays a role in our metabolism and our blood sugars. And then, of course, avoiding any kind of fruit juice, even if no sugar added or anything, it doesn't matter. It has no fiber and all it is just sugar. So no fruit juice, just eat the piece of fruit. Now, in terms of one other thing that I just really quickly wanted to mention that sometimes that's just a little bit of a trick, and this is actually from, I'll recommend another resource here, Dr. Michael Greger. He's a plant-based doctor and has this website called nutritionfacts.org and talks about evidence-based nutrition recommendations. And one of the things that he talks about for keeping a healthy weight and making sure that we're consuming the right amount of calories for us is preloading. And this can also be effective for some people for weight loss as well. So let's say if you have, your meal for dinner, let's say that's a pasta-based meal or something like that. If you eat a salad before that meal and then you serve yourself pasta, studies have been done to show that you're actually going to eat less pasta after you've had this high fiber, highly nutritious salad compared to if you just were to have the pasta alone. And so just thinking about that, like how you do, whether you want to do different courses for your meals, but using preloading as a strategy to make sure that you get your fiber in, that you get your micronutrients in, and then you can have as the second course, maybe something else that's a little bit more glycemically rich, but if you're going to have it anyway, have the salad first. So we talked about intermittent fasting. We talked about optimizing what we're actually eating, how much we're eating. Of course, knowing that our environment shapes our habits, right? So our work schedule, what we keep in our kitchen, where we typically eat. So all of those things, just keeping in our mind when we think about our general nutritional routine. And then the other piece that is really important and often underemphasized is mindful eating and avoiding multitasking when we're eating. And so often, right, we're eating and working at the same time, or eating and maybe watching something at the same time. When we really take the time to chew our food, to really be in touch with, am I full? How am I feeling? Do I need more? It just really helps us manage better how we eat, what we eat, and also allows for that digestive process to start in the mouth, in the process of chewing, as it should. We also want to be mindful with respect to sleep, because sleep also plays a role in regulating our hunger hormones and our satiety hormones. And so studies have been done showing that if we get insufficient sleep, that ghrelin, our hunger hormone, is actually going to go up, and leptin, our satiety hormone, goes down. So this is another really important piece. Now, what about metabolism and gut bacteria? I promised I was going to touch a little bit on the gut bacteria. And so what's interesting is that metabolic syndrome, which includes this insulin resistance, right, is in part thought to be a gut microbial imbalance issue. So in our gut, it's estimated to be that we have 1 million species of microbes in our gut, of bacteria, and actually even other microbes in our gut. And most of them reside in the colon. And as I'm sure you're all aware, there's been a lot of research and a lot of studies coming out to show how the gut bacteria are related to our mood, how they're related to our metabolism, how they're related to inflammation, and so many other processes in our body. Well, it turns out they're also related to our metabolism and our insulin levels and our weight. And so a study was done where they administered to people a probiotic together with a prebiotic, which is essentially certain fibers that the bacteria feed off of. And those individuals, after 12 weeks, experienced a reduction in their insulin resistance, reduction in weight, reduction in body mass index, reduction in insulin, and reduction in fasting blood glucose. So again, considering talking to your doctor about your gut microbiome and whether it may be worthwhile trying certain prebiotics and or probiotics. Another study also showed that after 8 weeks, blood sugar was improved, insulin was reduced, and HDL, the good cholesterol, was increased in women with PCOS who have a body mass index of 25 or above. And it also reduced their weight as well. And then lastly, another study was done with a symbiotic drink, which basically contained inulin, which is a prebiotic, a fiber, pomegranate juice, and certain strains of probiotics. And that also reduced insulin resistance. It reduced testosterone because, again, this is another hormone that can be elevated in women with PCOS, and it also reduced body mass index and waist circumference. So again, there is some emerging research that certain prebiotics and probiotics can also help our metabolism, especially in women with PCOS. So now let's talk a little bit about PCOS and what it is and what it entails. So we know that in PCOS, the etiology is not completely clear, but we do know that it involves hormonal imbalances, that it involves gut bacteria, that there is a genetic component, and then there's this neuroendocrine and metabolic components. So what are the diagnostic criteria for PCOS? Well, women have something called oligomenorrhea, or infrequent periods. That's typically less than 9 periods in a year, and they're typically more than 35 days apart. They also can have multiple cysts on ovaries. That's diagnosed by ultrasound. And then they tend to have hyperandrogenism, meaning elevated male sex hormones. And this can be present on lab tests, but it also manifests itself in acne or male pattern hair loss or male pattern hair growth, such as facial hair and so on. So what are some of the complications? Well, we know one complication that we were talking about are these metabolic issues. And so 40 to 85% of women with PCOS, because of these metabolic issues, have a body mass index of greater than 25. Insulin resistance is more likely to be present in women with PCOS. They're also at higher risk of type 2 diabetes. They may also be at higher risk of developing something called fatty liver. It's when liver doesn't break down fats normally, and then fat accumulates in the liver. And this is also related to the metabolic syndrome. PCOS may also be associated with mood disorders, depression, anxiety, and binge eating as well. And then estrogen, or the unopposed estrogen in PCOS, can also slow down thyroid hormone conversion from T4 to the more active T3 hormone. And then, of course, not to mention the potential fertility challenges and so on. So what are some of the solutions? So what I mentioned thus far with respect to intermittent fasting to support that insulin sensitization, with following this high fiber, plant-rich diet, healthy fats, avoiding, of course, processed food, processed sugar. Unfortunately, this is just something that's much more toxic to a woman with PCOS. than somebody who doesn't have this insulin resistance and these hormonal imbalances. But this is one way in which it can certainly be improved, and these metrics can be improved. Probiotics, again, emerging research on that. What about supplements? So one of the things that I mentioned is vitamin D. It's critical that even without PCOS, that we all have our vitamin D periodically checked. Besides its role in bone strength, vitamin D has also been shown to promote insulin sensitivity and also to support ovulation. Omega-3 fatty acids are also really important. They've been shown to help with menstrual regularity as well. I mentioned chromium and cinnamon, and some evidence that they can help with elevated blood sugar levels as well. A couple of other supplements that I sometimes use in my female patients can include chaste tree berry supplement. And this can be used for menstrual irregularity, for painful periods, for PMS, and also for breast pain during periods. What chaste tree berry does is it stimulates LH production, which I know UVA measures LH. So it stimulates LH production from the pituitary, and that in turn helps to stimulate increased progesterone level and also reduces FSH production, which lowers estrogen. And so that estrogen imbalance that's there with that estrogen dominance in PCOS and lower progesterone, that balance can be somewhat supported. But again, I certainly do not recommend taking it without guidance of a physician. It's really, really important to be prescribed the appropriate supplement at the appropriate dose with guidance of a physician and lab monitoring as well. Another supplement is inositol, and this also has been shown to help with insulin sensitivity. It has been shown to help with ovulation and increase in clinical pregnancy, actually in animal studies, and as well as in women undergoing ovulation induction. And this is also, inositol is also associated with lowering the male sex hormones as well for women who have elevated testosterone. So how to optimize our metabolism, especially in the face of PCOS. So it's okay to have breakfast. It's okay to delay it. But the bottom line is, if you can, do some type of intermittent fasting schedule or time restricted feeding. Avoid constant snacking. Focus on discrete, specific meals that you have and eat to satiety. Practice plant-based nutrition. Focus on protein, whole food, and plant-based carbs with reducing some of the higher glycemic index foods. Of course, exercise. I didn't dive too deeply into the specific kinds of exercise, but doing the exercise that makes you happy, that makes you fulfilled, that you enjoy doing is really what's most important. And then considering using supplements when indicated. I'm happy to answer any questions. And I always suggest, if this talk inspired you to make a change, and if it inspired you to maybe try something different with your lifestyle, with your diet, or to talk to your doctor about something, I recommend journaling that and writing that down, and perhaps thinking about setting some goals of, what would I like to change? How am I going to measure that change? And what are the specific steps that are going to help me get there? And I'm happy to take any questions.
We have time for a couple of questions if you guys want to jump in. That was really informative, Dr. Bojana. We did get a question early on. Maybe you can address that. How do you know if you need metabolic or diabetes testing? This woman's OB or REI hasn't necessarily suggested it, but she's wondering if it could be playing a role in her difficulty conceiving.
Mm-hmm. That's a really good question. So what's interesting is that, and I don't know if the individual that asked the question, if she was specifically diagnosed with PCOS or not, but what's interesting with PCOS is that regardless of the body mass index, women with PCOS have a higher likelihood of being insulin resistant. So it's not, even if her body mass index is in the low 20s, I still would recommend actually checking for insulin resistance checking a hemoglobin A1C. It's something that I typically screen for in all of my patients, regardless of what their chronic conditions are, because I think it's really important to track that, and also to discover it when the trend starts going upwards, as opposed to when the person already develops full-blown diabetes, and then we're actually working to reverse disease as opposed to prevent it, because prevention is always easier than reversal. But I would say, if specifically PCOS is the condition in question, then I would definitely ask her doctor to do those tests. And even if not, it should be part of regular screening. So if, she hasn't had this done through her regular primary care physician, I would certainly, recommend going in for a physical and inquiring about, getting diabetes screening.
Thank you. We got another question. What dosage of inositol do you recommend for PCOS women?
Mm-hmm. So it depends. I mean, I generally will actually start on the lower side of the dosages, just because it can cause some GI upset, some abdominal upset. So again, depending on what else she might be taking, what other strategies we're trying, whether there are some underlying GI conditions, I may start off on a lower dose and then kind of work our way up. And so it typically would be, on the order of maybe a gram or a couple of grams to start with, but it certainly can be titrated higher. I generally start more conservatively, and of course, always consult with your physician to know what the right dose is for you.
We have time for one more question if anybody wants to be the lucky person.
Yes. Can I have a question?
Yes.
Yeah, I was diagnosed with low progesterone, and what should I do, or what supplement I take to balance the progesterone and estrogen?
Mm-hmm, mm-hmm. And do you know was your diagnosis, was it PCOS?
No, I wasn't.
Oh, okay.
Yeah, I would just have low progesterone on my blood check, and my doctor has suggested me some supplement like vitamin D, melatonin.
Mm-hmm.
Yeah, but it seems like it doesn't really work because I keep having the same index almost like 2 years.
Mm-hmm. 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 I see. And is your estrogen elevated? Or is it
I
just the
have
ratio that's elevated? I assume.
no, I have normal estrogen, but
Mm-hmm.
low progesterone.
Mm-hmm. Mm-hmm. So it would be helpful to talk to your doctor and see if your doctor has a hypothesis as to why you have low progesterone, what might be the underlying cause of that, and then based on that, go from there. I did mention chaste tree berry supplement as one of the supplements that can support increasing progesterone through its activity through the pituitary. But I certainly, would recommend talking to your doctor about that first, because it would help to know what your doctor thinks causes the low progesterone, and then based on that, determining the best mode of action. But chaste tree berry or Vitex, you can ask your doctor about. Vitex is another name for it, so you can ask your doctor about Vitex.
Yeah, Vitex and chaste tree berry.
Exactly, it's the same thing. Yes.
Yes. Thank you so much.
You're welcome.
Dr. Bojana, thank you so much for your time. This was incredibly informative. I hope everyone found this to be useful. I can't really thank you enough. This is really great.
Wonderful. Thank you. Thank you so much. And thank you for the wonderful questions. And this was really such a pleasure.
Thank you so much.
Thank you so much, Doctor.
Oh, sorry. Go ahead.
Oh, you're welcome.
I hope everyone has a great day, evening, wherever you are. And thanks so much for tuning in. And follow us on Instagram or sign up for our newsletter to stay tuned for the next, segment of our speaker series that we'll be having in August. But thank you so much, Dr. Bojana.
You're welcome. Take care. Bye.
Bye.